Welcome back to Daytime. Dentist Mark Bishara and Sheri Margolian are here to talk about seniors and the oral health concerns related to the aging population. Thank you for joining us.
Welcome.
So there are some special concerns that the aging population has. I know one of them is the saying you've probably heard of is called "you're looking a little long in the tooth,"
Yes.
which is a saying because as you age, sometimes your gums can recede. But have you heard of that before?
Yes, of course, yeah. So what happens is as you age, your gum and your bone will pull away, it'll recede, and you're exposing more of the roots, so you get the phrase long in the tooth. What happens is that exposed root area is actually more sensitive, the nerves are more closer to the surface, and it's actually more porous, so it's more prone to cavities as well. So that's why you have to take extra care when you get older to keep your teeth really clean.
Is this something that's preventable, though, or does it just happen?
It just happens with age. We can do the best to prevent it by getting regular cleanings and checkups and keeping those surfaces as clean as possible. But it is one of those things that will happen as you age.
Well, you brought some pictures that you're going to show us, and we'll put the pictures up, and then perhaps you can walk us through what we're seeing. You have Biotene.
Yeah, so this is a product line called Biotene. As you age, what happens is you get less saliva. It decreases the flow. And the saliva is really important because not only does it keep your teeth really clean and lubricate them and wash away the food, but it also carries immune cells that helps fight off cavities. So along with that, a lot of people that are, as they age, take medications, and the majority of medications also cause dry mouth. And combining those two together, there's an environment where you're a lot more prone to cavities. So these are products, gels, toothpaste, sprays, help keep your saliva there, help stimulate them, but also replace what's missing. So it's a good products to use to help fight off cavities.
Wow, that's really good information. And you have another picture as well that we'll walk through. So what are we looking at?
So in terms of patients that undergo tooth loss for whatever reason, it can be cavities, it can be gum disease, the most basic form of replacing those teeth is with something called a complete denture, which is shown in the photo here. Although it's the most basic form, it's often not the best solution, since when you lose teeth, your gums and bone actually shrink over time underneath it. So there are better alternatives that we'll see in the next photo.
Okay, so I'd like to know the better alternatives. They're bringing that up. Okay, there we go.
So in this photo, on the bottom photo, you can see what we call snap-in dentures. And snap-in dentures use a number of dental implants to replace the teeth that we're missing and allow patients to actually snap their dentures in and out of their mouth without having to use alternatives such as denture adhesives, which you may have noticed sometimes with people noticing their dentures move when they talk and such. So dental implants are a great way to make those dentures stable.
You know, I've heard of the implants, but I had never heard of the snap-on dentures before. Is this new?
Well, it's a more new procedure as implants become more and more used. But even better than the snap-in dentures, you can replace your whole set of teeth fixed permanently onto the implants. So it's getting them closest back to natural as you can. You don't have to take it in and out. You just restore the implants with a full set of permanently screwed in new set of teeth. So it looks very natural, feels natural.
What are some of the other issues that, as people are aging, they need to really be aware of when it comes to their dental health?
Well, over time, our nerves are actually shrinking in those teeth. So you may notice on a younger patient, their teeth might be more sensitive. As we age, our body tries to protect itself. So it's actually a good thing, it's beneficial, but at the same time, you may not notice that there's problems that are happening in your mouth. So we often recommend for seniors to be in at the office every 6 months for regular cleanings, but also for checkups, because often these things are not seen in the mouth and can only be seen on x-rays.
Now, is it true that having extra plaque can also be related to heart disease?
Yeah, anytime where there's a communication between the two, any buildup of bacteria can always enter your system. So you want to be extra careful if you do have heart conditions to come in for more regular cleanings. But in general, as we age, I do sometimes say come in for 3-month cleanings instead of every 6 months, because as we said before, more roots are exposed and it creates more areas where food and debris can get caught in between. And there's only so much that brushing and flossing can do. Where there's bigger traps where food can get caught, we can do more at the office and clean it up for you. And then it can prevent some of that sensitivity and cavities and, like you said, getting more checked up for any cavities that are growing that you don't notice are growing.
What about the aesthetic look? How do we keep our teeth white as we age?
So over time, the inner color of the tooth is naturally a yellow color. So we may lose the outside coating of our tooth, which is the enamel layer. So there are alternatives where you may have to go procedures such as whitening your teeth. Sometimes there's cosmetic treatments such as veneers, which are basically coverings on the front of the teeth. There are crowns, which are coverings on the entire surface of the tooth. So there are ways where we can kind of camouflage what's happened to
Wow, I
underneath the
had
tooth.
no idea that the actual tooth was normally a yellowish color. I thought it meant it was stained. Thank you so much, both of you, for being here. It's always a pleasure. You have fascinating information.
Thanks for having me.
Up next, we have author Sheila Corneal. We'll be right back.